Hello, and welcome to Common Health, a podcast brought to you by the Virginia Community Healthcare Association, or VCHA. I'm Adrienne Harden, registered dietitian nutritionist here at VCHA, and your guest host for this episode. On Common Health, we discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by community health centers here and those who serve them. I am excited to be here guest hosting on today's episode of Common Health. We have two wonderful guests with us here today. So I'm going to read their introductions first before you get to hear from them. And first we have Meaghan Butler. She is a registered dietitian and fervent advocate for public health who is dedicated to advancing health equity for all. As Health Equity Director at the Federation of Virginia Food Banks, she is instrumental in fortifying Virginia's food banks to champion health equity. Through her leadership, she spearheads the implementation of our statewide health equity plan and fosters deeper collaborations within the health sector. With her unwavering commitment to improving policies and systems, Meaghan strives to ensure that every individual can attain their desired level of health. Meaghan received her Master's of Public Health from George Washington University. And we also have with us Maria Bowman, who serves as the Director of Health Initiatives at the Blue Ridge Area Food Bank in the beautiful Shenandoah Valley of Virginia. At the food bank, she leads food as medicine work and healthcare partnerships, including food pharmacies, the Healthy Pantry Initiative, and nutrition education. Her current work explores and acts on the question, how can we as a food bank contribute to dignified, accessible, culturally familiar, and health-promoting nutrition security within our community? She is a member of statewide systems and policy-level efforts, including the Health Equity Working Group and Food as Medicine Coalition. Maria received her Bachelor of Arts in Education and Justice, Peace, and Conflict Studies from Eastern Mennonite University and her Master of Public Health in Behavioral and Community Health from the University of Maryland. So I am excited. Welcome, Maria. Welcome, Meaghan.
Thanks for having us, Adrienne.
Thanks, Adrienne. So glad to be here.
We are so excited to speak today about what you all do with the food banks and also just, discussing food insecurity. So before we get too deep into our topics, we do like to start with an icebreaker. And today, since we're talking about food, we want to know, what is your favorite snack?
Kick us off. I was thinking, there's a lot of good choices out there. So y'all, I could have chosen many different things, but I'm going to land on a specific type of pretzel. I don't know if you guys have ever had Unique Splits pretzels. Unique Splits. You familiar?
No,
they
I
are
haven't.
Crunchy. They're hard, but they're not the ones that you get at the tip of, like, if I go to Food Lion, I'm probably not finding these. Unique Splits pretzels. They're like a little bitter, salty. I highly recommend them.
Okay. That was Maria. So thank you, Maria. And Meaghan, what's your favorite snack?
Mine is anything with peanut butter on it. Like even just a spoonful of peanut butter, straight to the source. I used to eat like a jar of peanut butter a week, and then I married my husband, who is deathly allergic to peanuts. So I have to go on peanut butter vacations when I'm away traveling for work and eat all the peanuts. Yeah. That's
Wow.
love. It's complicated.
Yeah, but that's love. That's love. Well, thank you, ladies, both for sharing that with us. I know we're talking about some very important and somewhat difficult topics today. So thank you for giving us a nice lighthearted start. And with us thinking about food, we also are thinking about the framework of food insecurity. So we know that that's an issue in our Commonwealth. And from what we've discussed, there's a lot of statistics around food insecurity. So can you ladies, feel free to choose who speaks on this, but can y'all talk a little bit as to why we even need these food resources for folks facing food insecurity?
Yeah, I'm happy to start us off here. So one of the things that's exciting about food banking is the desire of the network, the network of 200 food banks nationally and 7 food banks in Virginia, the desire to really look at how we address the root causes of hunger. right? We're moving beyond just it's enough to feed people, but really saying, well, why are people facing food insecurity, and how can we really work to address those root causes through the work that we do? So these root causes include poverty, unemployment, income inequality, systemic racism and racial discrimination, lack of affordable housing, chronic health conditions, and a lack of healthcare access. All of these huge systemic factors contribute to people experiencing food insecurity. And food banks are really working to say, okay, how can we play a role in advocating and working further upstream to make sure that we're helping people today, but also advocating for them to get access to better nutrition benefits and federal programs that are really going to help bring them out of this experience and support their long-term economic mobility.
Thank you, Meaghan. Thank you. And it is something that when you think about the network of the food banks and how you all are working to relieve and eliminate hunger, some of the stats that come to mind for me when I'm thinking about Virginia's food insecurity is you all did a great job of, showcasing that the food insecurity rate in Virginia is 11.1%. And looking at the national data from last year, from 2023 data, 13.5% of US households are considered food insecure. So we're really close to that national level. And I know working to reduce that is a huge mission for the Virginia food banks. Can y'all talk a little bit more too about maybe other resources that are available to those facing food insecurity in our Commonwealth?
Yeah, so there are 7 food banks, as I mentioned. There are also 1,100 food pantries across the state of Virginia. And these are, food bank is a warehouse that stores millions of pounds of food at a time, really considered more of a food hub. And the food pantry is a community-based food provider that's hyper local, really embedded in the community, and works to distribute that food directly to folks in need. We have, like I said, 1,100 food pantries across the state, and these pantries work day in and day out to provide food. But they also provide additional resources. Many pantries have their own nonprofit boards, they're their own 501c3s, they have their own missions, and do a combination of things, providing housing supports, providing financial trainings, providing mental health resources, providing clothing closets, really looking more holistically at the overall health needs of a person and seeking to address more than just food in that visit.
That's so important. Treating and looking at the whole person and not just one aspect of care. Awesome. And so
Yeah,
as
and
far as, go ahead.
I would
Maria.
just layer on the recognition, like Meaghan said, of the federal benefits. I think we recognize as a group of food banks that for every one meal that we can provide through our pantry partners, SNAP can provide 9 meals. And so there's such value in both working in tandem. And so we've really, especially over the last few years, as a group of 7 food banks across Virginia, we've asked ourselves, what does it look like for us to support our community members in getting signed up for SNAP and maximizing their benefits through SNAP? Because our goal is not to be a great food bank. Our goal is to eliminate hunger. And so we want to use all the tools we have available to us. And certainly that's using the food that comes through our doors and through our food pantry partners. And that means leveraging the federal benefit that exists and strengthening those benefits where we can. So we're trying to put all those puzzle pieces together in support of people who are facing hunger.
Amazing. And can you speak to that a little bit more? Because I personally got a chance to familiarize myself with that SNAP benefits assistance locator on your website. Can you speak to that and how you all are helping people get connected to those SNAP benefits and what that looks like?
Yeah, so the 7 Virginia food banks came together about 3 years ago, and we said, we're doing more to not just feed people, but also really address health and health equity. And one of the things that came out of that was we came up with a shared plan for how we would work together to address the health equity needs of those we are serving. And this was a new approach because the regional food banks really worked pretty independently, but this was taking us, challenging us to say, well, how can we actually add some efficiencies to our work and really innovate together to better meet the community's needs? And in that process, we really did some soul searching, met with some external partners, met with neighbors facing food insecurity, and really tried to understand how we could better support community needs. And that came out with a list of strategies that we could implement. And that included things like connecting the dots better between the food bank network and healthcare. It included things like intentionally sourcing healthy and culturally relevant foods and really holding ourselves to a high standard and measuring the percentage of nutritious foods that we're sourcing. It included things like addressing, helping people enroll in SNAP. So really deepening our capacity to help folks get connected to this program. So now 5 of our 7 food banks have a SNAP referral coordinator, somebody that can actually help folks in the community get connected to food for today, but then assist them in filling out the SNAP application, which we know is a really cumbersome application. It's like 30 pages long and can be really difficult for folks to navigate. So we have dedicated SNAP assisters that can walk folks through that process and make that process a little bit easier. And what we're finding is that some folks are reticent to apply for SNAP. There are concerns over the eligibility for the program, whether it's worth sharing all of this information, especially for new immigrants. Is it worth sharing all this information and worth the risk? But what we're finding is that when our network of food banks actually provides folks with food initially, it opens the door for them to consider applying for SNAP and to consider it builds trust in a way that allows folks to consider applying for the program if they weren't previously.
Great.
Yeah, and I would just add that we have a benefits outreach coordinator here at the Blue Ridge Area Food Bank. Shout out to Monica, who is such a myth buster when it comes to SNAP. I think many people have had negative experiences in the past. Maybe the amount that they received was pretty low, or they had misconceptions around how the program worked and who was eligible. And so what we were finding is that whether it's the partners we're working with at food pantries or hospitals or clinics or schools, or it's individuals themselves, there's a lot of misconceptions around SNAP. And there's a lot that we can do to say, actually, here's the truth around it. Here's what you're eligible for. There's no stigma here, and we can help you. And what we're recognizing is that there's a large gap between who is eligible and who is participating. And a large amount of that gap is based on the misconceptions and the stigma. And we have the potential to really reduce that gap with education and with support and with just reframing the value of the program and how we can help. So I think there's a huge opportunity there, and we're really starting to lead into that.
Amazing. And the first thing I thought of when both of you ladies were explaining the SNAP coordinator, the benefits coordinator, and how you said really taking away the barrier of how cumbersome and how maybe grueling that application is to do alone, and navigating that and having someone help them walk through it. And then, like Maria added, also getting rid of the stigma and a lot of the misconceptions and misinformation. So for our community health centers, which we have, over 30 main community health centers and over 200 plus sites connected within Virginia in our community health centers, some of the things we're thinking are, hey, how can we get more of our neighbors and patients connected with these benefits? So if you could say, maybe Meaghan or Maria or both, one line that you would want to say to the providers or even to the neighbors themselves of how to do this, or one word of encouragement, what would you say to them?
Well, I would say that they should look up their local food bank and find the public benefits or SNAP information and follow up with whatever it says. All 7 food banks have similarities and differences. So I can speak to the Blue Ridge Area Food Bank. We have Monica, who's our benefit outreach manager. And Monica's like, there's no wrong door here. I am a SNAP wizard, and she's going to provide you with whatever information or training or support is needed. So what I would say to a staff member at a community health center is go on the Blue Ridge Area Food Bank website, search for SNAP. You will find Monica's contact information, and she will show up and provide a training for your staff if you want to do that, so that they can directly help patients sign up for SNAP. Or she can come do what we call a SNAP clinic, where she can actually come with her team to your clinic and help people sign up directly. Or if you're on Unite Virginia, you can contact us through Unite Virginia and we can provide training on the phone to patients for SNAP applications directly. So any way that works for the community health center works for us. Go on the website, find your food bank, and find the SNAP person would be my suggestion.
And I would say we're here as a resource. It's a lot. And I know that food is only one of the social determinants that your health staff folks are screening for. And so just, know that Blue Ridge Area Food Bank, the model that they're implementing is being implemented in 5 other food banks. And we do have the ability to receive food referrals across the state, across all 7 food banks. So even if they screen for food insecurity, they notice a need, make a referral through Unite Us, make a referral through Find Help. Many of our food banks are also getting onto the Find Help platform. Connect that patient to the local food bank's hunger hotline, and then reach out to the food bank if there's a service that they need, but is not currently obvious or being offered. Because we're really trying to deepen our work in this space, recognizing the value of addressing food and also SNAP needs and other benefits.
Yes. And I'm glad you mentioned those resources, which are going to be included in the show notes too, because we really want to capture ways that not only our providers, but our neighbors and our patients can get connected to the resources that they need to access food. And
I would just say here that I love what Meaghan said about reach out to us, let us know. I mean, those are the existing mechanisms that we have. And honestly, those are based on the federally qualified health centers and the community clinics and free clinics that we're working with now. And that's what they asked for. And that's what that staff member had interest in or capacity for. But those don't need to be the only ways that we connect. Those don't need to be the only pathways. So I just, like Adrienne, you were saying, like, what if somebody wants to connect? I'm like, I want to meet you. I want to know who you are. I want to know who your patients are. I want to know what your idea is around what it looks like to connect these dots, because this is where I don't know, but I really want to help figure it out. And I think there's so much knowledge and insight at the community health worker level, the community health staff level. So we're very open to collaboration. I think we just need to connect the dots.
amazing. And I think this will help too, right? Getting these conversations started, getting the word out, and making sure this reaches the audience that it needs to reach. So thank you all for speaking on these topics today. And before we move on a little bit more into the food as medicine aspect of our talk today, I would like to hear maybe a little bit about how the evolution of the food banks has come about and what the future is looking like. Maybe where are they going from here? What's next?
Food banking has been evolving for quite some time. The first food bank started back in the 60s, and the focus when they started was really on donated food, donated unused cans of food, to be specific. And I think that's still oftentimes people's idea of food banking. But over the last 10 to 15 years, there's been quite a transformation in the network where food banks are now intentionally sourcing, as in purchasing, high quality foods. They're still getting some grocery and individual donations, but they're purchasing a lot more food than they ever have. And that much more food than they're getting through donations. And so with this increased focus in high quality foods, and there's been a recognition that food banks have a role to play in promoting health and promoting health equity. And so I shared, over the last 3 years, Virginia's food banks came together and created a plan for what it would look like for us to actually address health equity in our communities. Through that work, we hired health equity staff members at each of the 7 food banks. We hired SNAP coordinators at many of the food banks, referral coordinators at all of the food banks who can receive referrals from healthcare. We're really focusing on deepening our connection to healthcare, and then also centering the neighbor in the work that we do, making sure that we're not making a decision high up here without actually responding to our communities and our neighbors, and making sure that our evolution is not based on where we think that the food banking should go, but really responsive to where communities tell us it should go. We're sourcing culturally relevant foods now. We're working to remove barriers to access, including stigma, including transportation barriers, really trying to understand what it takes for folks to get to a pantry and how we can make that process of accessing food easier.
Yeah, I totally agree. I think there's been a huge evolution in thinking. And this was originally a charity mindset, and sort of one way there is extra food from manufacturers, and we can give it to people who are experiencing food insecurity. And so it was really fairly simple at its inception. And I think it's become more complicated because we've recognized that if we only think about it in that way, we can easily contribute to chronic disease, and we can almost compound the issues of poverty and systemic inequities because we're not recognizing the inherent complexity in our culture and people's lives. And so food banking is more complicated than it was before. And I think it is really working to address the inequities and to provide the foods that are nourishing and more culturally familiar to the people who need it and in the locations where they need it. I think when food banks were just getting off the ground, many of them were out of churches. And though churches are still crucial sources of, many churches are still food pantry partners, and we're grateful to them. And we recognize that not everybody feels comfortable in church spaces or has access to those spaces. And so we started to think about, where else are people who are food insecure spending their time? Where are they working? Where do their kids go to school? Where do they go to after school activities? Where are they on the weekends? And how can we co-locate food, nutritious food that folks really want, with the places where they're already working? Kind of like where do they play and live and work is very, public healthy in that sense. And so we have programs in schools, programs in libraries, programs at senior centers, programs with healthcare. And I think that's very exciting because it takes us out of the box that maybe we started in, and we're really evolving to say, oh, we can do better. We can provide more nutritious food. We can provide the right food and in the right places that people really need it. But I'll say we're not perfect at that either. We're really, the deeper we get, the deeper I think we need to go, and we recognize, oh, we can do more here. So we're certainly not, we haven't arrived yet, but I think we're going in the right direction.
Amazing. I want to touch on a few quick things that y'all said. Y'all both said, I'm just so thankful to have y'all here today. Y'all are touching on some points that I know our listeners need to hear. And one of the things you both mentioned was the importance of the health aspect of the food that is being provided and the evolution from being charity minded to now with health, nutrition initiatives, and even purchasing on the forefront. So the decision making is also coming from the food bank leaders as well. And one of the things we're aware of is that hunger is associated with poor health outcomes, and the food insecure individuals pay about $1,500 more on healthcare every year. So it's costing more in healthcare dollars as well. So it really does connect to what we're doing in the healthcare spaces as well as in the food bank spaces. And you also mentioned location. And I'm glad you mentioned that, because one of the things that we look at is how within Virginia, how can we reach all of the Virginians, everyone across every locality. And we know that 8 of those 10 localities with the highest rates of food insecurity are in our rural areas, and they're concentrated in our Southwest region. So we're really looking at ways to bring more food resources to areas that are needing it most, like you mentioned. And I did want to ask, do you all have like mobile food opportunities for people, as far as like programs? And even I think I saw a mobile food truck where y'all have fresh food on a refrigerated mobile van. Can you speak to that a little bit more?
One of the beautiful parts of food banking is that, solutions look different in different communities. And having 7 regional food banks and 1,100 hyperlocal food partners allows that difference in approach to manifest. And I think that's pretty crucial when trying to actually address the true community need. And I want to go back to the health and food insecurity connection that you said, because that was what got us to say, how can we help this? This is an issue. We looked at the data and we saw 2 things. We saw, one, the point you mentioned, food insecurity significantly increases a person's risk of developing most of the chronic diseases: depression, anxiety, diabetes, hypertension, heart disease, kidney disease, you name it. And we said, okay, this is true. And also, independent of food insecurity, let's say a person has a chronic health condition. Those are very costly. That having a chronic health condition alone can significantly increase a person's risk of developing food insecurity. And so both these things are true and can really perpetuate each other and result in a vicious cycle of food insecurity and chronic disease. And I think that's so important. When we think about our work, it matters to address food insecurity, and it matters to address food insecurity early in the process, before folks have had to make trade-offs in paying their food bill, paying their medical bill, paying their electricity bill. And we've heard through data that food is often the most flexible of the household needs, right? People are likely going to pay that mortgage, pay that rent way before they worry about putting food on the table. They can compromise, they can make changes to the way that they feed their families in ways that are less rigid than paying rent, right? They can make dietary trade-offs. They can purchase less food. They can purchase more processed food. So I think it's really important for us to consider how we intervene early in the process before those trade-offs have to be made. And I think that healthcare, the nexus between social care, the food bank network, and healthcare is really the answer to that. We need healthcare and other partners to be identifying folks who are food insecure and connecting them to these existing resources early and often.
I can chime in on the mobile piece too. At the Blue Ridge Area Food Bank, and I think that this is true for many other food banks. So I'll speak to Blue Ridge in particular, but I think this is broader than just our food bank. But we do have the mobile food pantry program, and that's a literal tractor trailer that goes into 10 different locations, rural locations, every month. And at one of those locations, I believe it's actually twice a month. But it's a recognition that in some communities, especially rural communities, it is very challenging to find partners for the food bank that can have a consistent pantry open. It's hard to find the churches or the community groups who have the staff capacity or the volunteers or the physical space to have a pantry, but we know the need is there. And so the way that we help to fill in that gap is to bring in that literal truckload of food once a month or twice a month into those communities. And what I'm really proud of is that the food that folks receive is about half produce and is often about 50 pounds of food. There's often meat and produce and dairy. It is high quality food. It's a substantial amount of food. And people show up for it because the need is really there. And so, to your point, Adrienne, different communities, different localities require different solutions. And so that's a challenge of this work. But I think it's one of those places where we can put our problem solving hats on to say, it's not a stamp. One size does not fit all here, but this rural community could benefit from this. And the coolest thing, the example here is in Rustburg, Virginia, but we set up a mobile food pantry for a few months, and we brought some partners and some individuals to volunteer with us at that mobile food pantry. And they got together and they said, thank you, Food Bank. We appreciate that you're doing this, but I think we as a community can start our own food pantry here. Wow. So within 3 months, we were actually able to phase out the mobile food pantry, and we're able to have a consistent food pantry partner there. And that's a success story for us because those individuals who are now running that pantry are from the community. They know the needs. And so we never want to make assumptions about what a community wants and needs, but we do try to fill in the gaps when that exists. But that consistent pantry will be able to be much more responsive and much more supported and much more integrated. Plus, they're open more frequently throughout the week, so it's just more accessible. So yes, we do have mobiles, and we try to make them into consistent pantry opportunities when we can.
That is so exciting. Wow. Congratulations too to that community for seeing that need and filling in that way. And real, while we're on this topic, can either myself, I know I'm a dietitian as well too, but I'd rather hear from, my public health experts here that I have. Can we speak to more about why it's so important to have you mentioned processed foods, Meaghan, right? And let's talk a little bit more about how the food itself, because we talked about the influence on chronic disease, but how do we get people to see, hey, it does matter, right? And what these healthy foods do for the body and how it affects a community as a whole in finance and medical debt. So we kind of touched on it, but do y'all have anything else to add as far as the food itself being medicine and preventative medicine at that and treatment?
One thing I will say is that we have a federally qualified health center partner, Healthy Communities Health Center in Harrisonburg. And one of the physicians there says this much better than I could. So Dr. Dominguez, this is for you. But he helped me to really understand in a different way that so many of his patients they weren't born in the U.S. and the foods that they grew up eating in their home countries were actually very healthy and minimally processed. And sometimes those folks come to the U.S. and they're not seeing the same nutritious options. And so in some cases, patients are really wanting nutritious, less processed food. But dang, we all know those are expensive foods. And there are lots of barriers to getting those foods, whether it's cost or transportation, language barriers. And so that's where we actually recognize that there is a demand for these foods. Like, many people do recognize the value of nutritious foods for their health, and they're not always easy to access. And so when we can help connect the dots between the food that folks really want and need for their health and accessing those foods, we want to do that. On the other hand, there's also space for supporting folks who may not have grown up eating those same foods. They might not be as familiar with the ways to prepare a butternut squash, or their palate may not be used to some of those flavors. And so I think I recognize that it's going to take a variety of approaches. We want to make sure that there is choice available, because I don't know what's right for you. I only know some broad categories of nutritious foods. That's what I want to be available. But in terms of what you put in your basket and what you take home, we always encourage our pantries to offer that choice when they can, so that the patients have the choice. And so I think when we can provide accessibility, when we can provide nutritious food and choices of those foods, paired with some education and some social support around that, we really can help overcome many of the different barriers that patients might come to this space with.
I'm glad you mentioned that. to with overcoming those barriers. As far as for what we're doing here at VCHA with the Food as Medicine program, one of the barriers we're trying to eliminate is not only cost with access to a dietitian, but also that barrier regarding nutrition education, and trying to add an additional layer of support for our health centers that maybe don't have a health educator, or they do, but their health educator is only focused on, maybe they have a certain population that they're working with, and they may not have the general nutrition education available as far as in a class form. So I'm glad you brought that up. And I know we're going to be closing out pretty soon, but Meaghan, you were about to add something.
Yeah, I was going to say, I think Maria did an excellent point of summarizing that. And I would add to that we've done a lot of surveying and focus groups with people facing food insecurity, and really trying to dig deeper into food preferences and access to nutritious food and what types of foods they really want through our programming. And the number one food that folks want is fresh produce. I think it's less about changing the perception of what folks should be eating, and more just providing access and layering onto that these additional nutrition education opportunities. And just to nerd out for a second, I've talked about this with you before, Adrienne, but I'm fascinated by Satter hierarchy of food needs. It's like Maslow's hierarchy, but for food. And the bottom rung of the pyramid is having enough food, right? And the top of the pyramid is like having the exact type of diet that I want and need, and it's enriching and it's flavorful. I think before we get to having the right type of food for my diet, we have to get to enough food. And that's where we're starting from. Once everybody has enough food, then we can layer on trying new foods and experimenting and getting more specific to the types of foods that my family wants and needs based on our cultural preferences. So I think it's a yes and. Let's start with making sure folks have enough. Let's give them opportunities to try new foods so that they can continue to make these slight nutrition nudges and improvements to their diet.
I was wondering, do we have a moment to talk about either the Healthy Pantry Initiative or food pharmacies? Just some
Absolutely.
sort of like teaser bits to kind of say. So one of the ways that we as a group of 7 food banks have decided that we want to step forward in this health equity work is the Healthy Pantry Initiative. And it was really born out of work that a large group of folks across the state who are interested in food as medicine work and folks experiencing food insecurity came together and said, what if all of these 1,100 pantries across the state had some guiding principles, some guiding lights to say, how can we do more to support guest health and dignity and access? And so that is the Healthy Pantry Initiative. It's 20 different practices that our pantries are encouraged to adopt when they can, where they can, recognizing that they're all different from one another. And the main categories are food availability. So making sure, for example, that a pantry has all 5 food groups. That's one of the practices. It's really important. Connections to health education is another one. Overcoming some barriers for guests is another one. And then Meaghan, help me out. What's the 4th one? So the 4 categories are food availability, being neighbor-centered, health education, and community connections. And they total 20 practices. And it's just a way to clearly articulate, this is what we as a food bank hope that our pantries can achieve with our support. And so we have an online training platform that we're providing all sorts of resources to our pantries. And so the Healthy Pantry Initiative just got off the ground last year, but the vast majority of our Blue Ridge Area Food Bank pantries are Healthy Pantry partners, and they're implementing these practices. And the stories that are coming out of it are really beautiful. I mean, we're providing funding and training, but then our pantry partners are really taking this guidance and bringing it to life. They're adding more glass front coolers to offer more produce. They're adding signage to highlight which foods are diabetic friendly and which foods are good for heart health. They are ordering a little differently to reflect the cultural needs. and they're creating a more welcoming atmosphere for their guests. They might be thinking about overcoming transportation barriers. So the Healthy Pantry Initiative is really exciting. It's happening across the state. And I think what's beautiful about it is that it's not a one-year goal. It recognizes that this is a sea change, a rising tide lift all boats, and we are working together to figure out what it looks like to not just provide food, but to provide nutrition and dignity and overcome these systemic barriers. That really is powerful when we think about it across food banks, sure, but also across organizations and individuals, and create a network around this food security work. And the other piece I wanted to mention is just the food pharmacy program. So the food pharmacy work is happening across the state, and it differs a little by food bank, but really what a food pharmacy is, it is food provided in conjunction with a medical service. And so sometimes it looks like an on-site food pantry at a clinic. We have a few of those within our service area at federally qualified health centers. We have a food pantry right there next to the real pharmacy, for example, or in the waiting room. But sometimes across the state, it also looks like food going with a community health worker or a nurse doing a home health visit to a patient in their homes. And there's other examples of what it might look like, but it really recognizes that we as a food bank can reach so many more folks, especially when thinking about folks who might have chronic health conditions, if and when we partner with healthcare in creative ways. And really, that's the food pharmacy program. And at Blue Ridge Area Food Bank, we currently have 26 food pharmacy distribution locations and about 7 healthcare partners. And we are really prioritizing federally qualified health centers and free clinics because you guys get it, to be honest. There's the right combination of factors there of staff with the knowledge, the resources, and the population that we often find is food insecure and benefits from the co-location of these services. So we're excited about the food pharmacy program. And again, I think we have a good thing going and it's still building. We're still figuring out what it looks like to do this well. And the healthcare providers are such a key factor here. I can't overstate how grateful I am for the amazing doctors, nurses, community health workers, social workers, dietitians. I see you. I appreciate you. And I think when we're able to connect with specific clinics and specific staff, the solutions we come up with are so tailored and so beautiful because it recognizes the real challenges and the real opportunities that are available in the community with this intersection of food and health.
Well stated. Amazing. Anything else to add, ladies, that we might not have covered? I know we can always pick up these conversations in the future, but you all did an amazing job highlighting that for us.
I'll add that I think this health equity movement among food banking is part of a broader shift to better connect these two huge sectors, right? The healthcare sector and the social care sector, the social needs sector. This is happening nationally in coding, figuring out the different codes as healthcare providers are now being required to screen for and address social needs. And so I think there's so much richness here and so much opportunity to continue to deepen our collaboration because it is having an impact. And we both bring so much to the table. And patients really value when their healthcare providers care about their social needs. And so much of health happens in the community. And I'll say that, when thinking about ways to deepen the collaboration here, one of our priorities is to get Medicaid to pay for food. Really looking at how we can leverage different payment mechanisms to solidify this collaboration and to solidify the way these two sectors work together. We're seeing over 20 states in the country are already using the Medicaid program to address social needs through demonstration waivers and in lieu of service policies. And we're advocating for that in Virginia as well.
Really speaking more towards like the 1115B waiver?
Yeah, exactly.
Okay.
1115 demonstration waivers, or there's another way that Medicaid can use their existing funding to pay for social supports called in lieu of service. It's just a policy that they can use.
Awesome.
So the Federation is leading the advocacy around how Medicaid could pay for food in the state of Virginia. I lead a Food is Medicine coalition as part of the work that I do. There are over 70 different folks in that coalition, coming from healthcare, coming from government, from food access organizations and community-based organizations. We come together quarterly to develop our, Adrienne's a member of it, and we really think about, what our collective voice is, what our priorities are, and how we can make that happen in Virginia. So that's definitely top of mind as far as next steps and how we can continue to deepen the collaboration. Is any listeners, if you're interested in joining this coalition, please reach out to me. Your voice matters, and there's so much opportunity here for us to make sure that there are enough food resources out there. I mentioned that, the food banks are purchasing more foods than ever and purchasing more healthier foods than ever. And this comes at a significant cost. And so when we think about all the innovations happening, we also need to think about how our funding mechanisms are keeping up with both the demand for these services, but also the evolving nature of these services.
The last thing I would add is just that I feel like this work is so energizing to me because, yes, it's complicated, but it's solvable. And there are so many smart, engaged, and creative people in this space. And we do have enough food, and we do have the resources. What we need to do is connect the dots differently than we've connected them before. And I think we are in an era, in a space where people are really waking up to their interest in doing that and seeing all of the resources that they and their organizations can bring to bear. And it's individuals with their skills in medicine, with their skills in being, a public health person or a physician or a social worker. It's leveraging Medicaid. It's all of this. And it's saying we can put these pieces together in a new way and create a new thing. So it is complicated. I think that's partially why it's interesting, but it's also solvable. And so I'm just really eager to continue this work because I think we're getting there and we are doing it together.
And get out there and try new things. I think the Food Pharmacy Initiative really came about because of innovations happening at the clinic and the food bank implementer level. So really continue to focus on the issue at hand and see how we can get creative to use both of our respective resources and expertises to really make a difference.
Awesome. Well, thank you, ladies, both. Thank you, Meaghan. Thank you, Maria, for being here with us today. Thank you, listeners, as well. And again, ladies, we can continue these conversations. I know, please come back. We'll say that. We'll just say come back and join us and keep us up to date on the progress and the amazing work you both are doing. I want to thank our guests for joining me today, and thank you to all the listeners for tuning into Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button and share with others on social media. Leave a rating and review, and visit us on our website at www.vcha.org. This is Adrienne Harden. Thank you for listening.